Today I'm going to talk a little bit about your core. So what is this core? What is it I'm pulling up, pulling in? What am I trying to do? So it makes sense that I explain it in a little bit more detail. So I'm going to use this and pretend it's muscles and maybe try and show you a little bit. This doesn't have the full rib cage and shoulders and stuff, but it may help you understand a little bit more. So when we look at the core, if you looked at a very big can of beans, that's your centerpiece, and in there we call it the powerhouse. So the can has a basin, a top end, and sides, and obviously contents in the middle. And if we pulled or vacuumed all the air out of the can, it would squash from the center. So what we're trying to do is create tension within your powerhouse to support your lumbar spine. So we look at the basin first. Let's have just a little fight with our skeleton here. So the basin, we've all got one, man and women. In men, slightly narrower, different shape. Women, we pass the baby through there sometimes. Okay, so that's the bottom of your basin, your pelvic floor. Now in the pelvic floor, we have a figure of 8 muscle that sits down in your basin. So you can imagine going through this bottom or the back bit would be the anus, and this would be the front bit, not as big as this figure of 8. But yeah, so that's basically how it sits. And if you think of this figure of 8 of muscles, it's not one muscle, it's many muscles, as levator ani. So you could think of it as an elevator, because you're going to lift it. So levator, as in lifting up, and levator ani could be related to the anus, but you could just think of ani, the person going up in the elevator. So yes, it's really important that we have support at the bottom of the basin. Other reasons for having a very strong pelvic floor is the prevention of leakage. So we're all familiar with it. Those of us who've had babies, then we may have had problems. I know I did in the past. And gentlemen, please don't think this doesn't relate to you, because any of your functions down there, very important, related to these muscles that support you. As we go into more mature years, we may have problems with our anal control, as well as our anterior control. So very, very important set of muscles down there. How do we engage them? How do we activate them? Well, basically just sitting here, I'm just lifting and squeezing. Now some people say to me, "Oh, I don't know, that feels quite sexual." It is. If you imagine having an orgasm and you feel those muscles all contracting, that's exactly what's happening. So the good news is, if we utilise the pelvic floor properly and we lift it on a very regular basis, then we will have a strong pelvic floor, which gives us stronger feelings in other directions. So some of the things you can do to practice that, and this is day in, day out, is sitting there and literally just feel like you're lifting. You can lift and squeeze and drop. So up, up, up. She's so annoying, but in a wonderful way. So that's my puppy. Hello, Boo. Very nice of you to join us. Yes. Then you can do pulses. So you can lift, 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 and then drop. Keep lift, 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 and drop. So I want you to be playful with this. It's a very, very important set of muscles. It's something that gets left out. We use it all for excretion, and we totally forget that it's there for a lot of other reasons. So that is your basin, that is your pelvic floor. I'm going to go to the top of it now, and around rib 7, okay, so 7 and coming down to 12, we have the attachment of the diaphragm. And the diaphragm is a dome that sits dome-shaped in here, goes out into the costal cartilages, and it attaches to your xiphoid process at the front. So if you feel down through here, you'll find a little knife point at the bottom there, and then there's nothing. So the diaphragm is quite huge, to be honest, excuse me, and it sits like this. From the top, if you was to look down on the diaphragm, diaphragm. It's like a heart-shaped muscle. And it's not just a muscle, in the structure of the diaphragm, it has a central tendon. And it needs that central tendon that sits close to the spine because that's where your aorta travels. You wouldn't want muscle squeezing your aorta. But what you do want, like the esophagus goes through the muscular tissue. So to help with digestion problems, our breathing with our diaphragm is very, very important. So I talk a lot about breathing. I think breathing is very, very important. You take your first breath when you come into this world and you take your last breath when you die. So how we breathe during our life is paramount. So a lot of people become what we call upper respiratory breathers. So they use all these accessory muscles up here. Really your breathing muscles are around the rib cage, your intercostal muscles. That just means within the ribs. And so your breathing becomes quite snatched and it's called a stress breath. So we're trying to get you educated into becoming much more natural and relaxed breathers. So you have been given belly breathing, which is a nighttime breath, or I call it a nighttime breath because it takes time to relax. And your belly breathing is when you breathe in through the nose and your belly gets fat, and then you squeeze the abdominal muscles and you exhale from the mouth. So it's like a circular breathing that you're doing. So you breathe in all the good air and the good energy, and then you blow out all that rubbish that we accumulate. So yes, so breathing really important. So that's belly breathing, but belly breathing doesn't allow us to strengthen our powerhouse here. So this instability that we can get in the spine. So we're going to teach you, or you've already learned, but hopefully utilising it well, is the lateral breathing. So where we take the bellows of the lungs and they come out laterally. Now to do that, we need to lock off at the diaphragm, which means squeeze the abdominal muscles, I'm coming there, and open up the rib cage at the bottom. So the lateral breathing that you've been practicing so beautifully is with the hands on the rib cage. You breathe in through the nose. It all opens up here, and then but still pulling up and pulling in here. So very, very important that you get that lateralizing of your breath. When you lateralize through your thoracic region, then you can really stabilize your core. So let's think more about the core now. So we've got the top of the can, we've got the bottom of the can, the pelvic floor, and the diaphragm. So the main muscle that I'm going to talk about is transversus abdominis. So this muscle attaches to the front via the pubic bone. If I do it this way and this way, this way and this way, and the xiphoid process. But it's not an up and a down muscle. Its fibers travel sideways. So the belly button in the middle, and then it comes all the way round from the pubic bone up through the pelvis, on the side of the pelvis, and then it wraps around into the back. Now the back, very complex area, as all of you know, has fascia. It's actually diamond-shaped fascia that sits out like this. So if you imagine this little piece of band is a diamond, that's called the lumbar thoracofascia. And this fascia is what the transversus abdominis attaches to. So it is a complete waistline belt. So when you get people, well not people, but heavy weight trainers, I've worked with a lot of strong men, I've worked with bodybuilders, and you see them, I don't know if you've been to the gyms, but you see them in the gyms and they get these big wide belts on and they strap them up as tight as possible. Now what they do is what we do when we give birth or have a poo, they bear down. So in bearing down, just to lay it on the floor, in bearing down, you see me from the side, I would be pushing out, really squeezing, and everything comes out. Instead of what we teach in Pilates, which is to pull in and hold this nice and firmly. So the reason for the belt, obviously, is they're doing heavy lifting. They cannot support or sustain the weight that they are lifting, carrying, or moving. So therefore they put a belt and then they blow out into it. And, oh, there you go. I've helped so many people who have been like powerlifting and stuff to correct their centre, to be able to squeeze their own belt, their own muscles, to create that strength around the core. Most athletes who haven't totally understood Pilates think they have wonderful cores. I have proven to many that that is not the case, unless you are literally squeezing in and really pulling up the pelvis, squeezing with the diaphragm and pulling in all the muscles, including that transversus abdominis, to create the powerhouse to stabilize your spine. Not only those muscles, obviously, they are the main thing that I would call powerhouse. I'd say pull up and pull in, pull up the pelvic floor, pull in here, and then breathe laterally using that diaphragm. Wonderful, perfect. We'll put a few more muscles with that, I think. So we obviously have the obliques. So the oblique muscles come in different angles around here. So they're what taper that lovely little waistline. So you have your external obliques. They come in at the side in this angle and attach down into your pubic bone and around the iliacus, or around the I'm trying to make this more human for you, but the pelvis, and they then attach up. So they have this sort of belt coming around here. So as you breathe, as you squeeze, they work in unison with the internal obliques, which have a different set of fibres going the opposite way. So if I was sitting sideways, this is the effect they would have. So external obliques, internal obliques. And as you squeeze and tighten those, they literally pull in everything and tighten around the transversus abdominis. And obviously you have those both sides. So that's the internal and external obliques. You have the glutes. We know the glutes are very, very involved with everything that we do, especially our posture. So your glutes will switch on. We have a little muscle out here on both sides, obviously. Tensor fasciae latae, everybody's heard of the IT band. Well, the top of the IT band attaches into the TFL, tensor fasciae latae, and the glute muscles. So they create a little bit of hip stability up here. So even if you're a runner or a cyclist, you need strong hips, side movement. That's a lot of things are missed out in this forward and backward movement. So strength, when we go into our Pilates side movements, you'll understand that hip stabilization is okay. So TFL, ITB, hip stabilization. Okay, so very, very important and does get left out. So a lot of sidewards movement, sideward lifting will help to engage that. The quad muscles, quadricep muscles, rectus femoris more than any, cross the pelvis. So again, that can have an effect, and crossing the pelvis with our hip flexors. So our hip flexors attach from our spine, so all down the lumbar spine and into our femur here, so they cross all of those joints. And then if you think the rectus femoris crosses and attaches to here, these two muscles interact to create some stabilization. Do you remember when we were younger, you used to put your feet, hook your feet underneath something like a sofa, or somebody would sit on your feet and you'd do all these sit-ups. That was hip flexor work. So that's, it's a good strong muscle. It's made up of three muscles. So iliopsoas, major and minor, and iliacus. So they all come from the top end, and it has this little insertion here. So all of that movement that we were doing, and if you hang and lift your legs up, same things using the hip flexor muscles. So in Pilates, we try to not destabilize, but to take the emphasis off of those and really make your center, your core work. Other muscles I want to mention. Okay, so you may not have heard of this, but I'm going to say it because it's important. So we have a whole set of muscles that come up the spine all the way. It's called, sensibly, erector spinae. Now the erector spinae, as I say, is a group, and we have fixations from the side to the very end one, so to the spinous processes, and the transverse processes, they can be singular, so from one vertebrae to the next, and they can jump 3 to 4 vertebrae. They work as a team. Wonderful set of muscles for keeping you nice and erect. They can get shortened in some people and over lengthened in others. Quite often the shortened area can happen in here, and quite often the overextended area as the head goes forward will happen here. So very important that we pay attention to these muscles because for our posture. Another muscle that I tend to work quite closely with is QL, quadratus lumborum. So imagine that your bottom rib is here and you have a four-sided muscle that comes down the spine, along the bottom rib and along the pelvis here. That's quadratus lumborum. Another little muscle that can cause quite a lot of back pain if it gets over tight. And again, this would do one-sided movement, but together, the two muscles together would cause extension. So if somebody's too lordotic or hyperlordotic, that extension would cause problems, and therefore I would go in and release the quadratus. But if QL's tight, if you think that causes extension, so does hip flexors. So again, that may be over tight. I see in a lot of people that they've been told they have tight hip flexors from a therapist, and quite often it's somebody who has a straighter lumbar spine, which really means that their hip flexors are a little bit weak and stretched. So it's about muscle balance. All of this is about muscle balance. So when I ask you to pull up the pelvic floor and pull in towards your spine with your belly button, we're engaging all of these muscles, and then you bring that fantastic lateralizing breath in. I hope that helps you understand a little bit more. I'm going to go on another session of video and explain about this forward head position, how we can rectify it, which muscles are involved, and then we should have some training programs to go alongside correcting them. Thank you so much for listening, and I hope that's helped you understand a bit more.